The goal of lumpectomy surgery is to take the cancer out and do the safest operation that we can, while at the same time leaving the breast looking the most like it looked before surgery. Most women with early stage breast cancer would be good candidates for breast conserving surgery. It depends on the size of the tumor, the size of the breast before the surgery, and also if there are multiple areas in the breast that have cancer. There are certain patients that will not be able to have lumpectomy surgery, and that would be patients that have what we call multicentric cancer, which means that the cancer is sort of spread throughout the breast in different areas of the breast, or patients that cannot get radiation. Usually when we talk about lumpectomy surgery, it comes tied to the idea of giving radiation, which is a therapy that is given after surgery. And so if you have any medical condition that would preclude you getting radiation, then that would not make you a candidate for it. When you do a lumpectomy surgery, the idea is to take out all of the cancer, right? But there may always be microscopic cancer cells left behind, and the goal of radiation therapy is to sort of mop up those cells, sort of eliminate them, anything that we have left behind, which is microscopic in nature. Usually when a patient will choose lumpectomy, they will have to have radiation on the back end of the surgery. If they don't need chemotherapy, they should get the radiation a couple weeks after surgery, maybe 4 to 6 weeks after surgery. If they are getting chemotherapy, the timeline will be surgery, chemotherapy, and then the radiation to mop up any remaining cancer cells that may be there microscopically. When you talk about a lumpectomy, the chance of the cancer coming back, usually we will tell patients it's anywhere from 5 to 10%. By getting adjuvant treatment, whether it be with chemotherapy, radiation, or anti-hormone therapy, usually those percentage points will be lowered. In the majority of cases, we are finding these cancers very early on, early stage. They have not spread. And so people do very, very well. Survival is very high. And so they should not feel like this is necessarily something that will end their life or completely change their life. And I want them to understand that breast cancer is something that happened, that we treated, that they successfully got over, and not necessarily something that will change their lives forever.